Of course, everyone knows of, or at least has heard of, sciatica. It's a problem, unsurprisingly given the name, relating to the sciatic nerve, whereby pain, numbness, pins and needles, and weakness can arise along its and its branch's course, stemming from the lower back travelling down to the foot. In last week's video, we spoke about the common areas in the body where muscular skeletal imbalances can lead to entrapment along its tract, and explained why those overweight are more susceptible to this. However, it's not the only nerve that can become irritated or compressed as a consequence of weight gain. The femoral nerve, alternatively running down the front part of your leg, can too, and can produce symptoms just as severe as its counterpart. Therefore, today we'll explore where this can also be negatively affected and how weight gain worsens its risk. But first, as always, please take note of our disclaimer. The femoral nerve is formed from the L2, L3 and L4 nerve roots of the lumbar plexus. So like sciatica, problems with the spine like spinal stenosis, disc herniation, spondylolisthesis, and the intervertebral foramen can lead to femoral nerve problems. However, these problems are less commonly the cause of a femoral nerve issue. Instead, entrapment sites outside of the vertebral column are more likely, with the first superiorly located at the psoas major muscle in the pelvis. The femoral nerve runs close to and slightly behind this muscle. So when the muscle shortens, compression or irritation of the nerve can follow. And this can happen as a result of anterior pelvic tilt. Primarily, this occurs from our poor daily postures at work and home, which leads to a common pattern of muscular imbalances where the glutes and quads become weak, while the iliacus erectors and the psoas major become shortened. Weight gain can also contribute though, since the disbalance of fat source between the front torso and behind it that comes with increased body weight causes the pelvis to shift in that direction. A common misconception is that shortness of a muscle always means it's simply tight, but muscles can also become short from overactivity due to taking on an extra compensatory load from other muscles. And the psoas major can do this often when the glutes aren't performing optimally. Anyway, this is the first way weight gain can add to a femoral neuropathy. Besides biomechanical adaptations of weight gain, intra-abdominal pressure can also be a reason the psoas major muscle starts hindering the femoral nerve. That's because of the increased visceral fat that builds up between your organs, meaning more pressure in the area. On a quick side note, if you'd like to undertake our evidence-based and results-backed personalized Plato weight management program, please click the link in the top right-hand corner of the video or follow the link in the description. Moreover, the femoral nerve can be impinged as it moves from the pelvis to the thigh from two different compressions at the femoral triangle, an area bordered by the inguinal ligament at the top, the sartorius muscle on the outside, and the adductor longus muscle on the inside. On one hand, apart from simply the accumulation of fat tissue in the area placing excess tension on the inguinal ligament and, by extension, the femoral nerve, the inguinal ligament can also get compressed through the shortening of the hip flexor muscles from anterior pelvic tilt. And on the other, shortening of the adductors, particularly the adductor longus muscle, can contribute to the femoral nerve being pressed upon at this site. Although shortened adductors aren't typically a direct consequence of muscular adaptation to being overweight, like the hip flexor muscles can be, they can be an indirect consequence due to compensatory strategies in return for other muscles in the area not being aligned and performing properly. Just after the femoral nerve exits the femoral triangle, it then in part transitions to its sensory branch known as the saphenous nerve, as it runs through the adductor canal at the medial side of the upper leg, aka Hunter's canal. This canal runs directly under the sartorius muscle to the medial knee, so much so that a third name for this canal is the subsartorial canal. Shortened adductors can compress this canal just like they can the femoral triangle, leading to impingement too, which can cause pain, numbness, and pins and needles in the inner knee and lower leg. But again, since this is a sensory nerve, muscle weakness won't be a consequence of the saphenous nerve impingement. Have you experienced any femoral nerve problems? Please let us know in the comment section down below. Additionally, if you're new here, make sure to like and subscribe to our channel. So That has been our video. Thanks for watching, and I'll see you next time.